My name is Amy Kyle, and I'm from UC Berkeley, and it's my great pleasure to be the moderator for the final panel here, where we're going to talk about how do we move forward from here. We've heard really some amazing presentations and very thoughtful discussions about the scientific issues and the research issues and what this actually means in terms of children's health kinds of issues. And we've also heard quite a bit about the existing policy context that we're in, which is partly about how we do risk assessment now. It's partly about the evolution towards thinking about cumulative impacts. We heard from George Alexeyev about the EnviroScreen tool that OEHA has been developing. And now what we're going to try to do is take all of those perspectives and all of the thoughts and all the diversity of viewpoints that we all have and think about, well, how can we move forward in tangible ways that are going to mean that children are healthier? So our real goal here is to improve the health of children, thinking about it, over the whole lifespan. And there are a lot of issues with that. We need to be cognizant of prenatal, preconception time periods, and we need to be cognizant of the implications for early life or later disease. So we're trying to take that all into account here. Think about this world of cumulative exposures, cumulative impacts, stress, SES, the interaction with genetics, all that. It's a lot of complexity, and I think sometimes the complexity seems daunting, but I don't believe it is. I believe out of this discussion, we can see places we're getting stuck. And I think we're creative enough to think about, well, let's not get stuck. Rather than get stuck, let's figure out something that will be useful to do that will be good for children. Because that's the whole purpose of this whole thing. And I know everyone here is committed to that and has invested a lot of time and energy and personal, whatever, your personal capacity in trying to think about how to do this. I also want to acknowledge the pioneers in this are here. The state of California has moved further along in many ways on both the cumulative impacts issues and also on children's health than other entities. And we have the blessing of a wealth of resources here, both within the agencies and with our community groups and advocacy community and our university. So we have a lot of capacity here to figure this all out. And the last thing I want to say by way of introduction is I also want to recognize the way in which this is always a little bit surreal. And the reason for that, of course, is because people from the community side have been talking about the impacts of freeways and ports and things that accumulate in their communities for many years. And, I am thrilled and delighted by the scientific presentations that we heard and the really breadth of thoughtfulness and quality of work that we heard. And on the other hand, we hear about things that now we can establish scientifically that people in communities told us about 30 years ago or 20 years ago. So it's, if I look at it from their point of view, it's, gosh, okay, great, we're catching up now to what people have been telling us for a long time. And when I look at it from the science point of view, it's really thrilling, the work that's doing that. So I'm not sure I can fully integrate those two perspectives either, but they're both there. I mean, there's a science part of this that is in some way behind what people are really experiencing. And I hope we'll take that as a sense of urgency, that we can't just discuss this forever. We need to really figure out how to do well by kids and by our communities too. Okay, so I want to make just a few comments about the scientific issues that arose and how we might move forward on those. I'm going to take just a minute to do this. I've distributed some notes to some of you who are the speakers and so on. And I think we identified a lot of places people are getting stuck now. Should we be more quantitative or not quantitative, and should we focus on disease or should we focus on sort of early markers of effect, and should we try to quantify everything or should we kind of try to quantify nothing? And I think actually in a lot of these dualities, there's probably some of both that will be useful. And one of the great innovations of this EnviroScreen model is, maybe in my mind, the greatest innovation, but I'm not going to argue that there aren't other ways to look at it. But one important innovation is it lets you take things that are quantitatively assessed and combine them without having to fit them all into one quantitative model. And I think that's hugely important. So, Asa Bradman's suggestion that maybe we should work with that a bit, I think could help clarify everyone's thinking amongst those of us who are on the research side. So there are a lot of things like that that came out. How we think about quantitative, less quantitative, and a number of other issues like that. And what I'm going to ask the people on the research side to do is let's see if we can't put our heads together to resolve these different ways that we're looking at things into a way we can move forward. Maybe sometimes we do this, sometimes we do that. When we can't quantify something, let's figure out what we can do so we don't just get stuck. And try to focus this session a little bit more on the bigger picture of how we move this forward. So I'm going to ask you to do that. Let's listen to kind of the perspectives of our wonderful panelists that we have here, and think a little bit at a little higher level of how do we move this all forward, and try not to engage in the things we've debated many times. Let's set that aside for now, for this panel, and agree to come back and work on those. And I am going to be calling you. So those of you who worked on putting this panel together know that I will be calling you to help us do that. So that's what I would suggest for this. So I would like to introduce our...
Amy had the foresight to give us some questions in the meeting materials, and I'm going to touch on 3 of them that I think are relevant to this panel. The 3 questions were, how can we better incorporate social vulnerability and biological susceptibility into assessing and acting upon cumulative impacts? How does and should cumulative impacts fit into the research plans of the Children's Environmental Health Research Centers? And finally, while we're working on reducing environmental exposures, how can we strengthen community resilience? I'm going to try and touch on all of these, but I think they all relate to 3 kind of big picture things that everyone in this room, I think, is struggling with, which is how do we enhance the rigor, the relevance, and the reach of the science that we're doing on cumulative impacts in children's health? And by rigor, I'm talking about, we had a lot of discussion about, are scientific methods good? Are our models well specified? Are our measurements appropriate? Do our study designs make sense? We've had a very good discussion about that. I'm going to move away from that rigor question and talk more about the question of how do we enhance the relevance and reach of our science based on what we know now. So the first question I want to get to is that we actually, even though this field of cumulative impact science is in its infancy, we actually know quite a bit now. And I think a lot of that can be translated now into enhancing tools for decision making. I think the CalEnviro screen that Dr. Alex Saif talked about at the beginning of the presentation is an outstanding product of a lot of our scientific work. And I think there's ways to think about how we might expand that effort. I think the beauty of CalEnviro screen is that it's actually being applied to a very specific policy context. Right now, decisions are going to be made about how to distribute funds from revenue generated through cap and trade and AB 32 to vulnerable communities in the state. CalEnviro's screen, those maps that you saw are going to inform those decisions about where resources can go to vulnerable communities. And so I think that based on the science today, the question before us is, how could we extend CalEnviro screen to better characterize the environments where children tend to spend a lot of their time? So one thought that I had is, can we think about extending CalEnviro screen to characterize the environments of children's schools? Could we use such a screening approach to look at school environments? We have a lot of data already amassed in the current Enviro screen. The Department of Education has excellent data on the socioeconomic status of schools, the students that go there, how they're performing on test scores, school absenteeism. Can we promote that kind of interagency collaboration to extend CalEnviro screen to characterize what's going on with kids while they're at school and where they're spending a huge part of their day? The second question I want to talk about, and Joe's going to clobber me for discussing it, but I'm going to discuss it anyway because it came up, is what are the implications of what we talked about yesterday for risk assessment? And how do we take social vulnerability into account? Really start taking concrete steps towards that. And the issue of when, whether, and how we apply risk assessment to decision-making to protect public health is hotly contested and very controversial. Stakeholders, particularly environmental justice and environmental health advocates, point out that in many ways risk assessment is a dead end in terms of really thinking about how we get to where we want to go, in terms of reducing exposures, decreasing emissions, and limiting the proliferation of mobile and stationary emission sources that tend to concentrate in low-income communities of color. Nevertheless, while I agree with that sentiment, yesterday the question did emerge about what are the implications of our scientific work for risk assessment and cumulative impacts analysis. And fundamental to this is how we incorporate vulnerability. So current risk assessment practices address differential susceptibility for certain intrinsic biological factors, most notably age. Okay, so we already do have a process in risk assessment where we apply default factors to protect biologically sensitive populations, such as children. So OE has a default factor of 10 for early life exposures is a case in point. So can we start putting our heads together about how we do this for what I would consider to be extrinsic factors, these social vulnerability factors? Can we begin to think about the range of effects that might actually move us more towards the application of default factors for social vulnerability in the same way that we think about it for protecting kids? So I would urge us, I think, to put our heads together to really think about that, because I think there's some very good data already out there that could sort of get us on our way towards doing that. And much in the same way that we've adopted default factors to account for early life exposures to protect kids, I think we can start reviewing the data for different outcomes and examine the range of values, effect values that occur in terms of observed interactions, either in the animal or the human data, to estimate what a parallel default factor might be for social vulnerability. The third thing is thinking about another question that emerged from yesterday's science is how do we move surveillance away from the lamppost? And I'm talking about exposures to environmental chemicals. There's good talks by Drs. Martin Smith and Tracy Woodruff about the need to move towards non-targeted approaches. Because while we do want to focus on certain contaminants that we know are of concern, clearly we also need to get a better handle on what we call the known unknowns. The fact that we all know that people are probably exposed to a lot of other chemicals, we just haven't really gotten there yet. So the question is, how can we leverage some of these emerging methods like time of flight to change the way we do biomonitoring surveillance in representative samples of the population? And I think that there's some potentially good opportunities to test these methods in these kinds of contexts. Also, can we think about ways to collaborate where we can leverage these incredible cohorts that people have developed to test some of these unbiased methods across cohorts and see how well they're working in terms of sensitivity, specificity, and validity? And then what are the implications of translating that for surveillance activities among public health agencies? And particularly in California and also nationally. The next thing is thinking about how we move upstream. We've been focusing a lot in our science in terms of following the molecule. We're very good at quantifying chemical exposures. We're getting even better at quantifying people's individual exposures to stress. We're even getting very good at quantifying biomarkers of stress response, whether it's allostatic load, cortisol, telomere length, all kinds of things that many of us are working on. But I would argue we also want to think about broader institutional contextual factors, which is why I love, again, EnviroScreen, because it is thinking about place-based things. Some of us are moving towards neighborhoods, but I want us to think even more broadly. There's a lot of very good literature out there to suggest, for example, metrics of social inequality at the metro level, at the regional level, and the county level adversely affect the health of the communities that live within them. And I know that communities themselves and community stakeholders are very concerned about these institutional factors. We do have the capacity to measure them. Is there a way for us to expand beyond our perpetual focus on so-called risk factors also to get more towards resiliency factors, as Dr. Bradman suggested in his talk and as others have raised in our consequent discussions? Finally, I want to make a pitch for participatory science policy making, not just for communities, but for scientists. I know many of us don't consider ourselves policy people, but people and policymakers, decision makers, listen to what we have to say. They want to know how much things cost. They want to know if they're going to get sick. They want to know if we would live in that community, drink that water, and breathe that air. They want to know what we think. And we can have a big influence, and particularly in terms of how we shape the discussions in our professional societies and among our colleagues and sort of move beyond our comfort zone in terms of taking a stance on what we think the scientific evidence says now, given all the caveats of the data and other problems that we have. And so I think that we can do more also to do constituency building amongst the communities and the vulnerable communities in which we're basing our studies. Communities have, a lot of the work that has been funded to build these cohorts has been funded by agencies like the National Institutes of Environmental Sciences and US EPA. They have often encouraged us as scientists to do community engaged work, translate our research. This event is in part a product of that. And I would argue that we even sort of move further in terms of community engagement and engage communities more in thinking about the development of relevant metrics that are relevant to them. There was a very good point raised in Dr. Corey Schlechta's beginning of her presentation when she talked about, community members know the things that stress them out. And sometimes those are even more important than lead, mercury, these other kinds of things that tend to be our focus. And I think this kind of participatory science policy making can lift up solutions that we may not think of. So the kinds of things that Rob and John were thinking about, land use implications of a lot of the science that are emerging from the traffic-based studies. So Amy's standing up. You want me to end now? I'll wrap up. Okay. So I think this is critical towards extending the reach of our science. It responds to environmental health advocates and the ways they push us to really keep thinking about how we translate our results and our emerging knowledge into tools and strategies to promote policy action now, even as our science evolves and gets better. It acknowledges that while good science can advance public health, sometimes our quest for better science can slow us down and slow our progress towards our primary goal of disease prevention. We're all about public health, and I think finally it acknowledges that at some point we need to move forward and make tough policy decisions, even when the science may be somewhat equivocal. And I think we're definitely there right now with cumulative impact science, based on what I've heard and what I've been reading, and whether it's about toxics, lead, traffic, or whatever. Children's health, public health advocates, environmental justice advocates, I think, have kept scientists like myself and regulators honest. They hold our feet to the fire, and they're constantly reminding us that ultimately when the facts are in and the question of what is to be done about cumulative impacts and how we move forward, eventually it's no longer a scientific question, it's a moral one. So I'm going to end there.
And thank you, everyone who's put this together and brought us here today. I didn't remember those questions that Amy asked us, actually, because Amy doesn't know how to ask a simple question, nor does she know how to ask a single question. And she had asked us a different question, too, which was, what are the short-term and long-term things we think where we should go from here? And in order to try to address that question last night, I went straight to the source. And when I was tucking in my 6-year-old daughter, I told her I wasn't going to be there in the morning when she woke up. And if I'm lucky to make my flight home, I will be there before she goes to sleep tonight. And she wasn't too happy about that. And I said, well, I need to go, and I need to try to protect kids from pollution. And we had a little discussion about it. And in the end, I said to her, so what should I tell them? And she told me, tell them not to put that icky stuff in the air and the water and other things. And in some ways, I think she nailed it right on the head. I mean, it boils down to pollution prevention, not creating a problem in the first place, and dealing with the problem at different levels, not just at the risk assessment, risk management level. And you know, the insights of a 6-year-old are always the ones that I think are the most important. But I think of the risk assessment, risk management, health impacts, decisions that we're confronted with. And Amy didn't mention, I'm also the governor's appointee to the South Coast AQMD Governing Board, so I wear both the hat of being an advocate for public health and for air quality, but also the decision maker. And I get confronted with having to make some very tough policy decisions. And along those decisions we make, the continuum of risk assessment, where we start with, are there hazards in the community? Are there emissions or releases? Are there exposures, dose, health risks, adverse health outcomes? Along that entire continuum, we have opportunities to do something. And I think what I heard yesterday on the webcast and today is that the scientists who are working on this issue are getting that it's not just about risk assessment and risk management, that we have to do and intervene and get good decisions all along that continuum. We have to reduce the hazards in the environment so that they never become releases, so that those releases and those emissions never happen if we can prevent those. And if we can't prevent those, then we have to prevent the dose. And if we can't prevent the dose, we have to prevent the risk and the adverse health outcomes. Now, from a community perspective, along that continuum, the farther along that continuum you go, the harder it gets to prove that you're right and that there actually is some problem. So I think the more sophisticated route and the more intellectually honest route is to try to deal with this problem at every level. Now, I say a lot of negative things about risk assessment. I don't want to give people the impression that I think there's no role for risk assessment. I think some of the scientists who we heard from yesterday and today are doing absolutely the right thing. I mean, the short answer to what the problem is and what the solution is better science, more science, and better policies. And I want to, you know, encourage and support the work of the scientists and the work that they're doing to show us where those shortcomings are. I mean, because when it comes to the communities, there's really nothing more fair than an independent researcher who is trying to seek the truth and using evidence to do it. So back to risk assessment a little bit. There are very serious problems. We heard about a lot of them yesterday. There are far too many assumptions, far too many unknowns. We don't know if we're being too conservative or too liberal in our conclusions. And that one of the biggest problems for people who first confront the kind of issues when they realize there are either one or a number of pollution sources in their community is that they focus on that very end. What are the adverse health outcomes? How can we prove that our children are actually sick? Well, that's the hardest thing to do. And then they're told that there are risk assessments that are showing that there's, you know, no problem in their community. And it just becomes a nightmare for them because there's a patina of legitimacy that's given to it because it's called science, when in fact we know that there are all kinds of assumptions that are problematic, all kinds of unknowns with regard to both the long list of chemicals and the toxicological endpoints that are associated with them. There are scientific problems with focusing only on that approach. There are also ethical problems with focusing only on that approach. I am actually at the 5-minute mark, and I know Amy doesn't want us to go much over. I'm going to wrap up as quickly as I can, but to say that I think that what we're seeing is an emergence based on science of a possibility of getting away from a risk assessment, risk management paradigm and to using our knowledge about things like oxidative stress, which if I had to explain to my 6-year-old, I'd say that's how things get torn apart in bad ways, or electrophilic chemical reactions where things get put together in the wrong way. That kind of knowledge and that kind of information may well form the basis for an alternative approach that is better informed, more valid, and more helpful for the communities involved. Thank you.
Thanks, everyone. This is really wonderful to be here. I'm so happy to have been able to participate in this whole conference and learn so much from all of the presentations yesterday and this morning. And in reflecting on those presentations and on what has been going on here at Cal EPA and specifically at OEHA in the 7 months that I've been here, I just had a series of thoughts about how to take some of these concepts maybe and move them a little further along and take some of the conceptual issues and try to see if there are ways to make them more real. And the Cal Enviro screen does a lot of that. And so I'm very proud of OEHA's work on that. And I just think that it's a really great effort to put some science behind both, on the one hand, things that communities have been pointing out for a really long time, but now there is actually something that sort of, does put science behind those concerns. And also, to create something that's really a practical tool that we can use for a whole series of things. It's going to be very useful for setting priorities, for directing funding, as Rachel mentioned, for making sure that businesses and other entities in those communities are obeying the law at a minimum. All of those kinds of things are going to be important. But when you really think about it, what are the next steps? Well, we can get down to a finer geographic scale. We can add another set of indicators, but we're fairly quickly going to hit a point of diminishing returns because as you add more indicators, we just keep identifying the same communities. So it becomes more refined, I guess, but not really different. Because of the fact that it is a ranking and it's useful for screening and priority setting. So what we really need is to take this concept and use it to develop an assessment tool. I was thinking about, you can call it Cal Enviro Assess. And then when you put Cal Enviro Assess and Cal Enviro Screen together, then you have the Envirome. Because what we need to do next is we need to start focusing more closely on these communities. We need to start doing what Asa Bradman talked about yesterday when he tried to sort of run the Enviro screen for Salinas. But that's where you hit all of the limitations of our current tool where we're relying on statewide data, because so many of the issues that were discussed at this meeting aren't really reflected very well in statewide data, but you can start getting at them if you start looking more at the community level. So focusing in on individual communities, we can start looking more carefully at housing quality, at violence, at food access in the community, at land use, at pollution. In some communities, such as Fresno, as John presented, there's very detailed information on air quality. So we can actually take advantage of data that have already been collected for some of these key impacted areas. And that will actually then allow us to start to move away from a relative ranking or relative scoring, which is useful for priority setting, to a more absolute scoring system, something where we actually really take up the challenge of trying to move to quantitating in some way all of these disparate factors, using the general methodology that was developed of looking at pollution burden times social vulnerability, as we've already sort of come up with that framework. We can use it, I think, as we get down to a tighter geographic scale and with different indicators. And there could even be multiple levels of those kinds of assessments, because you could conceptualize going to community level data and then really getting in depth, getting on the ground and doing some exposure monitoring. using some of the tools that Martin Smith talked about yesterday, such as the smartphone-assisted monitoring technologies, some of the more mobile air monitoring equipment, so that we could actually engage the communities in doing some of this testing, democratize the information, upload it and incorporate it. We could, start really making use of some of the non-targeted methods. I'm really happy to say that we should have the capacity to do non-targeted screening, I hope within the next year at Cali, PA. So, why not start testing groundwater, drinking water, and biological samples in key areas, and wrapping those results into the same tool. And then if we're going to do that, then it starts sort of blurring the boundaries between, the sort of regulatory prioritization and assessment and research. And so, the findings of research teams are going to start just dovetailing much more, I hope, smoothly into some of the assessment tools that, if we can develop them at the community level. And that also would allow us to then start looking at early biomarkers of effect, such as oxidative stress, immunological markers, endocrine alterations. And that takes me to Tox 21. Tox 21 came up yesterday. It's a federal effort. It's a big train that's leaving the station, and we really do have to figure out whether this is going to help us or hurt us or will be useful to us. And I think in some ways, I was thinking about Tox 21 a little bit like the EnviroScreen. I think it's a very major conceptual advance, and I think it's very useful for screening and for priority setting. And then I think we need to think, about how to move forward with that. There are, a couple of things. I mean, obviously, beyond the priority setting role where it flags certain substances, it also gives us some ideas maybe about how to group chemicals.
As I was thinking about this panel, I was remembering over a decade ago when we were really engaged in the effort to pass the Children's Environmental Health Act and to really try to shine this focus on all the children's health data and the need to update our air quality standards and our air toxics regulatory efforts to take into account children's health impacts and the unique vulnerabilities. And that process really shined a light and began to reconnect, I think, policymakers and legislators with all of the great work that was being done in the scientific community on this. And I think over the past decade, all of that work has made a tremendous difference in promoting our air quality, climate change regulatory agenda. I mean, the children's health study that's been discussed at length today, and especially and the near roadway component has made a very big difference. Now, as I'm sitting 10 years later, and I'm looking at all of this through the lens of our policy agenda at the American Lung Association in California, and my key focus is, of course, on policy and advocacy. And our key focus is doing a lot of things that we've talked about today that are critically important to prevent exposures and to build community resilience. And we're very focused on moving beyond dirty petroleum fuels and transitioning to cleaner energy and supporting the implementation of our air quality and climate change laws to help do this. And again, reminded how critically important all this data is. We need to continually bring this data, the cost of air pollution on children's health, into the policy arena. And I just wanted to talk about a few specific areas that we're engaged in terms of smart growth, in terms of some diesel pollution reduction policies, and the cap and trade program, and just talk about, again, what are some of these short-term and long-term steps to make a difference. First of all, we've talked a lot about the SB 375 process, Sustainable Communities. It's a critically important effort, and the American Lung Association and many other groups are very engaged in this process. Just taking a look for a moment in Southern California, in Los Angeles, which many people would think is the epitome of the opposite of smart growth, of course. Dependence on cars, huge challenges there. And when the policy process began in that region under this law to talk about how are we going to plan for more sustainable communities, there wasn't much talk about public health, I have to say. There wasn't a connection. We were looking at a time still when planners weren't really talking to public health agencies and public health leaders. And because of the engagement of the public health community, that conversation happened. And I just wanted to say that it was an amazing experience to watch the change in the dialogue as there's all of a sudden more discussion about how are we going to achieve public health objectives? How are we going to take into account all this information we have about regional air pollution exposure, how we need to bring this down through our growth and transportation patterns, and looking at the near roadway exposures, the data that Rob has brought up today. How are we going to deal with communities that are in close proximity to freeways? The kind of data that Rob brought up today reminds us that we need to continue to work towards smarter growth, more compact communities, but we need to do it in a way that's informed and takes into account a close look at how we're going to deal with impacted areas that are near freeways. And for example, because of the involvement of the public health community in the Southern California region, the Southern California Association of Governments actually developed some maps of impacted areas near freeways. And there was a plan was begun to do more evaluation of those public health impacts and to look at what can be done in terms of, for existing areas, of course, that are already impacted, in terms of filtering, what other high-efficiency filters and other mitigation measures can be used to help address impacts in those communities. So as we're moving forward with sustainable communities planning, we need to be taking into account, and we are, the impact on these subregions, areas that are close to freeways. Nothing cancels out the need for sustainable communities and smart growth. It's critically important policy. We're greatly thankful to the Air Resources Board for the leadership in moving this agenda forward. But we do need to take whatever measures we can to reduce those impacts and to stop building in a way that is going to continue these problems. Clearly, we have to stop this era of putting schools within 100 feet of a freeway. That has to end. We also need to continue to push the policies that are going to clean up cars, trucks, freight, rail yards, all of these sources that are causing tremendous health impacts in children, as we talked about today. Our clean cars regulations, our zero-emission vehicle regulations, efforts to produce cleaner freight planning are critically important. And again, when we go to policymakers and we bring the data that's been presented through this forum, when we say, okay, there's $400 million just in the South Coast region, for example, of health impacts because of asthma from near freeway exposures, that has a big difference in helping explain why we need to move forward with our clean fuels and clean cars, zero-emission vehicle policies. When we look at the 9,000 plus premature deaths that are occurring every year because of air pollution impacts, all of this data, again, is critically important. And right now, how could it be 6 minutes?
I don't think it lies.
Right now, we're involved in another key initiative that's moving forward this year. Again, aimed toward prevention. Two critical programs, one aimed at reducing diesel pollution, the Carl Moyer program, folks are, I think, very aware of this. Another critical program, the AB 118, which is a program aimed at putting advanced technologies, advanced vehicle technologies on the road and building the infrastructure we need to fuel those technologies. And moving us, again, beyond dirty petroleum fuels to clean, zero-emission, and sustainable fuels. These programs are critically important, and they're going to be running out of funding within a couple of years unless the legislature acts to reauthorize this funding. again, we're talking about prevention. The Caramoyo program itself has replaced over 48,000 diesel engines across the state that are causing exposures. These programs, again, can be reauthorized, but we need to get the legislature and the public energized to get this done. This is a key effort that we're working on this year in the legislature. I can give you more information on that. But again, this is a key preventative measure that we can all work on to make a huge difference. Another key area is the cap and trade funding, another key area where we can make a difference. And this has been brought up before, and we're really pleased and thankful for the tremendous work that's been done to produce the screening tools that will help to make sure that some of that money is directed to communities that are most impacted. And we think that, again, this is another key priority, that we need to be directing funding to promote healthier communities and promote children's health, and to support key policies like the SB 375 process. So all in all, as we look forward, again, our key focus is on how are we going to reduce exposures, and since transportation is, of course, the key pollutant that is contributing to our air pollution and climate change problems, our key focus is on moving beyond dirty petroleum fuels. And again, we need to rely on the data that you are developing through this research and the children's health impact data to help change policymakers' minds, because policymakers are very concerned about their constituents with asthma. They're very concerned about children's health, and the fact that children's lung development is going to be impacted and affect them for a lifetime makes a huge difference in how they're going to vote on these issues. Thank you very much.